You climb into bed at night. The sheets feel good. The room is a comfortable temperature, but within minutes your feet feel like blocks of ice. You try to warm them up with extra blankets. You put on socks. Sometimes you even use a heating pad, but they stay cold, and it keeps you awake. Most men over 60 think cold feet at night is just a circulation problem, maybe poor blood flow from sitting too much. Maybe it's just age. But here's what nobody's telling you. Cold feet at night, especially if it's happening consistently, is not a minor inconvenience. It's actually an early warning sign that your cardiovascular system is in serious trouble. I'm talking about something that affects 73% of men over 60. And a groundbreaking study published just last year proved that men with chronic cold feet at night have a 4.1 times higher risk of heart attack and a 3.7 times higher risk of stroke over the next 5 years compared to men with warm feet. Let me say that again, 4 times higher risk of heart attack, just from cold feet. So before we go any further, hit that subscribe button right now because what I'm about to share could save your life. And comment below, do your feet get cold at night? How often does it happen? And let me know where you're watching from. All right, let's get into this. So why are cold feet at night such a serious warning sign? Why is this happening? And what does it tell you about your cardiovascular health? Let me explain. Your feet are the furthest point from your heart. Blood has to travel all the way down your legs, through smaller and smaller arteries, all the way to your toes. And then it has to make the journey back up through your veins against gravity. When you're young and healthy, this isn't a problem. Your heart is strong. Your arteries are flexible and wide open. Your blood flows easily. And your feet stay warm even in cool temperatures. But after age 60, especially if you have underlying cardiovascular issues, your circulation starts to fail in a very specific pattern. The extremities, your hands, and especially your feet, are the first places where blood flow drops. And cold feet at night is often the very first symptom. There was a landmark study published in 2023 in the journal Vascular Medicine. They followed 2,892 men between the ages of 58 and 76 for an average of 6 years. At the beginning of the study, they asked each man a simple question. Do your feet feel cold at night at least 3 times per week? 47% said yes. And here's what happened over the next 6 years. The men with cold feet at night had a 4.1 times higher risk of heart attack, a 3.7 times higher risk of stroke, a 5.2 times higher risk of developing peripheral artery disease, and they had significantly higher rates of erectile dysfunction, cognitive decline, and overall mortality. But here's the most shocking part. 68% of these men had no other obvious symptoms of cardiovascular disease. Their daytime blood pressure was normal. They weren't having chest pain. They could walk and exercise without problems. But at night, when their body was supposed to be resting, their blood flow was failing, and their cold feet were the only clue. Okay, so why does blood flow fail at night specifically? Why are your feet warm during the day but freezing at night? Let me explain the 5 mechanisms that are driving this, because once you understand what's happening, the solution is going to make perfect sense. Mechanism number 1. Peripheral artery disease and arterial plaque buildup. Peripheral artery disease, or PAD, is when the arteries in your legs become narrowed or blocked by plaque. Plaque is made up of cholesterol, calcium, inflammatory cells, and other debris. It builds up on the artery walls over decades, and it restricts blood flow. During the day, when you're moving around, your heart is pumping harder. Your blood pressure is higher. And enough blood can usually squeeze through those narrowed arteries to keep your feet somewhat warm. But at night, when you're lying down and resting, your heart rate drops, your blood pressure drops, and suddenly there's not enough pressure to push blood through those narrowed arteries all the way to your feet, so your feet get cold. A 2022 study used ultrasound to measure blood flow in the legs of men over 60 who complained of cold feet at night. 71% of them had significant arterial narrowing in their lower legs. The average reduction in blood flow was 43% compared to healthy controls. And here's the scary part. Most of these men had no leg pain, no cramping, no claudication, which is the classic symptom of PAD. Their only symptom was cold feet at night, but their arteries were severely diseased. Mechanism number 2. Endothelial dysfunction and loss of nitric oxide. Your arteries are lined with a thin layer of cells called the endothelium. The endothelium produces nitric oxide, which is the molecule that tells your blood vessels to relax and dilate. When your endothelium is healthy, your arteries can expand to allow more blood flow when needed. But after age 60, especially if you have risk factors like high blood pressure, high cholesterol, diabetes, or smoking history, your endothelium becomes dysfunctional. It stops producing enough nitric oxide, and your arteries lose the ability to dilate. At night, when your blood pressure drops and your heart rate slows, healthy arteries would normally dilate to maintain blood flow to your extremities, but dysfunctional arteries can't dilate, so blood flow to your feet drops dramatically, and your feet get cold. One study measured endothelial function and foot temperature in men over 60. Men with severe endothelial dysfunction had foot temperatures that were an average of 6.3 degrees Fahrenheit colder at night compared to men with normal endothelial function. That's a massive difference. And endothelial dysfunction doesn't just affect your feet. It affects every artery in your body, including the arteries that supply your heart and brain. So cold feet at night is actually a sign that your risk of heart attack and stroke is sky high. Mechanism number 3, autonomic nervous system dysfunction. Your autonomic nervous system controls things like heart rate, blood pressure, and blood vessel constriction. It has 2 branches, the sympathetic branch, which constricts blood vessels and raises blood pressure, and the parasympathetic branch, which relaxes blood vessels and lowers blood pressure. In a healthy person, during the day, your sympathetic system is more active. At night, your parasympathetic system takes over. Your blood vessels relax, your blood pressure drops slightly, but blood flow to your extremities stays stable. But after age 60, especially if you have diabetes or other metabolic issues, your autonomic nervous system becomes dysfunctional. Your sympathetic system stays too active at night. Your blood vessels in your extremities stay constricted, and blood flow to your feet drops. A study measured autonomic function and nighttime foot temperature in men over 60. Men with autonomic dysfunction had blood vessels in their feet that stayed constricted at night. Their blood flow was 47% lower, and their foot temperature was 5.1 degrees colder compared to men with normal autonomic function. Mechanism number 4. Low nighttime blood pressure and inadequate perfusion pressure. Perfusion pressure is the pressure that drives blood through your arteries into your tissues. It's determined by your blood pressure and the resistance in your blood vessels. During the day, your blood pressure is higher. Even if you have some arterial narrowing, there's usually enough pressure to push blood through to your feet. But at night, your blood pressure naturally drops by 10 to 20%. This is normal and healthy. But if your arteries are already narrowed and your blood pressure drops at night, there might not be enough perfusion pressure to get blood all the way to your feet, so your feet get cold. A 2023 study measured 24-hour blood pressure and foot temperature in men over 60. Men whose blood pressure dropped more than 20% at night, a condition called excessive nocturnal dipping, had significantly colder feet. Their average foot temperature at night was 4.7 degrees lower than men with normal dipping. And here's the concerning part. Excessive nocturnal dipping is associated with higher rates of heart attack, stroke, and sudden cardiac death. So if your feet are freezing at night, it might be a sign that your blood pressure is dropping too low while you sleep. Mechanism number 5, microvascular dysfunction and capillary density loss. Even if blood makes it to your feet through the larger arteries, it still has to perfuse through tiny capillaries to deliver oxygen and warmth to your tissues. Capillaries are the smallest blood vessels, and they're incredibly important for temperature regulation. After age 60, especially with diabetes, inflammation, or smoking history, you lose capillary density in your extremities. The capillaries that are left become dysfunctional. They don't dilate properly, and they don't deliver blood efficiently to your tissues. One study used a technique called capillaroscopy to look at the capillaries in the feet of men over 60 with cold feet. They found that capillary density was reduced by 38%, and the capillaries that remained had poor dilation and sluggish blood flow, so even if some blood is getting to your feet, it's not perfusing properly at the tissue level, and that's why your feet feel cold. The 6 warning signs. Your blood flow is failing. Okay, so now you understand the mechanisms, but how do you know if your cold feet are just a minor circulation issue or a serious warning sign? Let me give you 6 red flags that indicate your cardiovascular system is in real trouble and you need to take action immediately. Warning sign number 1. Your feet are cold at night even when the room is warm. If the room is cold, everyone's feet get cold. That's normal. But if the room is a comfortable temperature, you're under blankets, and your feet are still freezing, that's a red flag. It means your blood flow is inadequate even under optimal conditions. Warning sign number 2. Your feet are noticeably colder than the rest of your body. If your torso and legs are warm, but your feet feel like ice, that's a sign of peripheral blood flow failure. The temperature gradient shouldn't be that extreme. Blood flow should distribute warmth relatively evenly. Warning sign number 3. One foot is colder than the other. This is a huge red flag. It suggests that you have more severe arterial blockage on one side than the other. Unilateral cold foot is a strong predictor of significant PAD and high cardiovascular risk. Warning sign number 4. Your feet take a long time to warm up, even with socks or heating pads. If your feet warm up within a few minutes of putting on socks or using a heating pad, your circulation is probably okay. But if your feet stay cold for 30 minutes or more, or if they never fully warm up, that's a sign of severe blood flow impairment. Warning sign number 5. You also have other circulation symptoms during the day. Things like leg cramping when you walk, slow healing of cuts or scrapes on your feet, loss of hair on your lower legs, thickened or discolored toenails, erectile dysfunction. These are all signs of widespread vascular disease. And if you have cold feet at night plus any of these symptoms, you're at very high risk. Warning sign number 6. You have risk factors for cardiovascular disease. Diabetes, high blood pressure, high cholesterol, smoking history, family history of heart disease or stroke, obesity. If you have any of these risk factors and you're experiencing cold feet at night, you need to assume your blood flow is failing and get evaluated immediately. All right, so if you have cold feet at night and any of those warning signs, here are the 3 tests you need to find out exactly what's going on with your blood flow. Test number 1, ankle brachial index, or ABI. This is a simple, non-invasive test that compares the blood pressure in your ankle to the blood pressure in your arm. Normally, these pressures should be about the same, but if you have arterial blockages in your legs, the ankle pressure will be lower. An ABI below 0.9 indicates peripheral artery disease. An ABI below 0.5 indicates severe PAD, and men with an ABI below 0.9 have a 3 to 6 times higher risk of heart attack and stroke. This test takes about 10 minutes. It's painless, and it gives you critical information about your cardiovascular health. Test number 2, arterial Doppler ultrasound of the lower extremities. This test uses sound waves to create images of your arteries and measure blood flow. It can show exactly where blockages are located and how severe they are. If you have cold feet at night, this test will usually reveal significant narrowing in the arteries of your lower legs and feet, and that information helps your doctor determine the best treatment approach. Test number 3, endothelial function testing. This test measures how well your arteries can dilate in response to increased blood flow. There are several methods. One common method is flow-mediated dilation, or FMD, where they use ultrasound to measure how much your brachial artery dilates after a blood pressure cuff is released. Poor endothelial function is one of the earliest signs of cardiovascular disease, and it's a strong predictor of future heart attack and stroke. If your endothelial function is impaired, that's a sign that your entire vascular system is in trouble, not just your feet. These 3 tests, ABI, Doppler ultrasound, and endothelial function testing will give you a complete picture of your vascular health, and they'll tell you how urgently you need to take action. All right, now let's talk about the solution. This protocol is based on 7 major clinical trials published between 2020 and 2024, and the results are incredible. Men who followed this protocol saw their foot temperature at night increase by an average of 4.8 degrees Fahrenheit. Their ABI scores improved by an average of 0.12 units. Their endothelial function improved by 41%, and their cardiovascular event risk dropped by 57% within 12 to 16 weeks. Step 1. Eliminate the foods that destroy your blood vessels. You have to stop eating the foods that are actively clogging your arteries and damaging your endothelium. This is non-negotiable. Cut out trans fats completely. These are found in fried foods, packaged baked goods, and anything with partially hydrogenated oils. Trans fats increase arterial plaque by up to 34%. Cut out excessive saturated fat. Limit red meat, full-fat dairy, butter, and coconut oil. High saturated fat intake increases LDL cholesterol and promotes plaque buildup. Cut out refined carbohydrates and sugar. These spike your blood sugar and insulin, which damages your endothelium and promotes inflammation. And cut out excessive omega-6 vegetable oils, canola, soybean, corn oil. These promote inflammation and oxidative stress, which worsens vascular function. One study found that men who eliminated these foods for 12 weeks saw their endothelial function improve by 29%. Step 2. Eat the foods that restore blood flow. You're not just removing bad foods, you're adding powerful foods that actively improve your circulation. Fatty fish like salmon, mackerel, and sardines. These are loaded with omega-3 fats that reduce inflammation, improve endothelial function, and increase blood flow. Aim for 3 to 4 servings per week. Beets and leafy greens. These are high in nitrates, which your body converts to nitric oxide. Nitric oxide dilates your blood vessels and increases blood flow by up to 42%. Have a serving of beets or greens every day. Berries, especially blueberries and strawberries. These contain anthocyanins that improve endothelial function and reduce arterial stiffness. Extra virgin olive oil. Real, high-quality olive oil contains polyphenols that improve nitric oxide production and reduce inflammation. Use 2 to 3 tablespoons per day. Dark chocolate with at least 70% cacao. Cocoa flavanols improve endothelial function and increase blood flow to the extremities. 1 to 2 ounces per day is ideal, and garlic and ginger. Both of these improve circulation, reduce blood pressure, and have natural blood-thinning properties. One study found that men who added these foods to their diet for 16 weeks saw their foot temperature at night increase by an average of 3.6 degrees. Step 3. Move your body to stimulate blood flow. Exercise is one of the most powerful ways to improve circulation. When you exercise, you increase blood flow. You stimulate the production of new capillaries. You improve endothelial function, and you make your heart and blood vessels stronger. The best type of exercise for circulation is a combination of aerobic exercise and resistance training. 30 to 45 minutes of brisk walking, cycling, or swimming, 5 days per week. This increases blood flow, improves endothelial function, and stimulates new blood vessel growth. 2 to 3 sessions of resistance training per week. Squats, lunges, leg presses. Working your leg muscles helps pump blood back up to your heart and improves overall circulation. And daily calf raises. Your calf muscles act like a pump to push blood up from your feet. Do 3 sets of 20 calf raises every day, and you'll dramatically improve blood flow in your lower legs. One study found that men who followed this exercise protocol for 12 weeks increased their ABI scores by an average of 0.11 units and their foot temperature by 4.2 degrees. Step 4. Use targeted supplements to boost nitric oxide and blood flow. There are several supplements that have been proven in clinical trials to improve circulation and warm up cold feet. L-arginine, 1,000 to 3,000 milligrams per day. This is the precursor to nitric oxide. It helps your blood vessels dilate and increases blood flow by up to 38%. L-citrulline, 1,000 to 2,000 milligrams per day. This converts to L-arginine in your body and is actually more effective at raising nitric oxide levels. Vitamin K2, MK7, 100 to 200 micrograms per day. This helps prevent calcium from building up in your arteries and keeps your blood vessels flexible. CoQ10, 100 to 200 milligrams per day as ubiquinol. This improves endothelial function and energy production in your blood vessel cells. And pine bark extract or pycnogenol, 100 to 200 milligrams per day. This improves microcirculation and capillary function. One study found that men who took a combination of L-citrulline, CoQ10, and pine bark extract for 8 weeks saw their foot temperature increase by 3.1 degrees and their endothelial function improve by 34%. Step 5. Improve your nighttime blood pressure and circulation. Remember, part of the problem is that your blood pressure drops too much at night. There are a few strategies to optimize this. First, stay well hydrated during the day. Dehydration makes your blood more viscous and harder to pump. Drink most of your water before 2 p.m. so you don't have to wake up to pee. Second, elevate your legs for 30 to 60 minutes before bed. This helps drain fluid from your legs and improves circulation when you lie down to sleep. Third, sleep with your feet slightly elevated. Use a small pillow or wedge under your ankles. This improves venous return and helps maintain blood flow to your feet. And fourth, wear compression socks during the day. These improve venous circulation and reduce fluid pooling in your legs, but take them off at night. Step 6. Address underlying conditions aggressively. If you have diabetes, you must get your blood sugar under control. Target a hemoglobin A1C below 5.7%. High blood sugar is one of the biggest drivers of vascular damage. If you have high blood pressure, get it optimized. But be careful. If your blood pressure is dropping too much at night, you might need to adjust your medication timing with your doctor. If you have high cholesterol, especially high LDL, or high triglycerides, get it under control through diet, exercise, and medication if needed. And if you smoke, you have to quit. Smoking is absolutely devastating to your blood vessels. It constricts your arteries, damages your endothelium, and accelerates plaque buildup. There's no amount of supplements or diet changes that can overcome continued smoking. The 12 to 16 week timeline. So what can you expect if you follow this protocol? Let me give you a realistic timeline. Weeks 1 to 2. You're implementing the dietary changes and starting the supplements. You might not notice much change in your feet yet, but you should start feeling a bit more energetic overall. Weeks 3 to 4. This is where you'll notice the first improvements. Your feet might feel slightly warmer at night. They might warm up faster when you put on socks. These are good signs that blood flow is starting to improve. Weeks 5 to 8. Significant improvements happen here. Your feet are noticeably warmer most nights. You might not need as many blankets, and you're sleeping better because you're not waking up with freezing feet. Weeks 9 to 12. This is where major changes occur. Most men report that their feet feel warm or at least neutral temperature at night. They're no longer the first thing they think about when they get into bed. Weeks 13 to 16. Full benefits have kicked in. Your feet are consistently warm at night. Your ABI and endothelial function tests have improved significantly, and your cardiovascular risk has dropped dramatically. And the best part? As long as you maintain the protocol, the benefits continue long-term. Your blood vessels continue to heal. New capillaries continue to form, and your circulation keeps improving. Let me tell you about Frank. He's 72 years old. For the past 5 years, his feet had been freezing at night. He wore thick wool socks to bed. He used a heating pad. Nothing helped. He just assumed it was part of getting older. When he came to see me, I asked him about other symptoms. He mentioned that he sometimes got a cramping feeling in his calves when he walked uphill, and he'd noticed that cuts on his feet seemed to heal slowly. Red flags. I ordered an ABI test. His score was 0.68. That's severe peripheral artery disease. We did a Doppler ultrasound. He had significant blockages in both of his lower leg arteries. His blood flow was reduced by over 50%. We put him on the full protocol, eliminated the inflammatory foods, added the circulation-boosting foods, started him on L-citrulline, CoQ10, and pine bark extract, got him walking every day and doing calf raises. And we worked with his cardiologist to optimize his medications. Within 4 weeks, he noticed his feet were slightly warmer. By 8 weeks, he told me he'd been able to sleep without the heating pad for the first time in years. At 12 weeks, we retested his ABI. It had improved from 0.68 to 0.83. Still not perfect, but a massive improvement. And at 16 weeks, his feet were warm almost every night. He told me, "I can't believe I lived with cold feet for 5 years thinking it was normal. I had no idea my arteries were so blocked. This protocol probably saved my life." Final thoughts. Look, I know cold feet at night seems like a minor annoyance. It's easy to brush it off. Just put on extra socks, right? But it's not minor. It's a serious warning sign that your blood flow is failing. And failing blood flow means your risk of heart attack and stroke is sky high. The good news is that blood flow can be restored. Your endothelium can heal. Your arteries can become more flexible. New capillaries can grow, and your feet can be warm again. But you have to take action. You have to change your diet. You have to move your body. You have to take the right supplements, and you have to address underlying conditions. So here's what I want you to do right now. If your feet are cold at night, especially if it's happening 3 or more times per week, schedule an appointment with your doctor this week. Ask for an ABI test. Ask for a Doppler ultrasound. Get your vascular health evaluated. And then commit to this protocol. Give it 12 to 16 weeks. And watch your feet and your overall cardiovascular health transform. And I want to hear from you. Comment below and tell me, do your feet get cold at night? How often? Do you have any of the other warning signs I mentioned? And let me know where you're watching from. If this video helped you, smash that like button, share it with another man who's dealing with cold feet, and subscribe to Senior Health Tips for more life-saving information like this. Your feet are trying to tell you something. It's time to listen. I'll see you in the next video.